President Muhammadu Buhari passed away in a London clinic, making him the second Nigerian president to die in a foreign country, particularly while receiving treatment. Well, joining us now to take a look at the state of healthcare delivery in Nigeria with a particular focus on the growing trend of health tourism, especially among the nation's political and economic elite, is first Vice President, Nigerian Medical Association, Dr. Benjamin Olowojebutu. Thank you very much for joining us on Newsnight. First, let's get your thoughts on this growing trend. Maybe first off, help us paint a picture of Nigeria's healthcare delivery system and why our political leaders seem not to have confidence in our healthcare service.
Thank you. I think it's important we know that you can't say Nigerians be patriotic, and you as a leader can't do the same thing. It's been a lot of problems over and over again that leaders leave the country in jeopardy, leave the country in this bad state, and use taxpayers' money to go abroad to get themselves sorted. I think it's it's not very good. Right now, we have about $7 billion leaving the country on medical tourism every year because we don't trust our system. The government has failed Nigerian healthcare space, and now we're supposed to have one doctor to 600 patients. We have one doctor to about 10,000 patients. No value for healthcare, no passion for the country, and we keep saying, think about Nigeria first. The leaders are not thinking about Nigeria first. Health is supposed to be the right of every patient in this country. But right now, health looks like it's very, very secluded, only for leaders that can afford to travel abroad at the twinkle of an eye. I think right now, there's a lot of dilapidated environments. The healthcare is not functioning. The right system are not functioning. The policies are just policies. They just copy and paste policies because people don't know what's really it's important for Nigerians. We have people coming in with policies that are taken from the US or from the UK that are not very applicable to Nigerians and for Nigerians. I think it is high time we look at it properly. When the president died, we commiserate with President Buhari, but you can see the high point. He said the president died in a London clinic. How many of those presidents of those countries die outside their country? In America, we just lost Jimmy Carter a few months ago. He died in America. That's what you talk about, loving your country. Why would you go and die outside the country? Because the country that you live in, you don't trust them. You don't trust their health care. You don't trust their health professionals. You don't invest in them. Where's the funding? Where's the passion to make healthcare great in this country? Because you can afford to go abroad, what happens to the 200 million Nigerians that cannot afford to go abroad? I think it's high time we look at it critically and change some policies where politicians don't take our money outside the country again. Let there be a law to say they must stay in this country for healthcare going forward. Thank you.
Interesting, but is it really about policies? Do you appreciate the argument by some people who say capability, misdiagnosis, push some people to seek help abroad? In President Buhari's case, to be fair to him, he has been seeking medicals in London even before he became president. But how do you respond to his special advisor, a former spokesperson, Femi Adesina, who said if the president had remained in Nigeria, he would have been dead long ago? He said it was a matter of life and death. Some will interpret that to mean that the expertise to manage the president were not available in Nigeria.
I do appreciate what Femi Adesina said. I think it's it's a slap on the country. And most of the people treating the president abroad, we know them, they are Nigerians. So you leave this country and go and get treated abroad by the same Nigerians that left this country because they wanted greener pastures for themselves. Femi Adesina should take back that word he said today. I think it's inappropriate and very, very insensitive. We have great technical people, great physicians that can treat the president. I remember one time that somebody, maybe it was even the president that traveled because of ear pain. I say we don't have fantastic ENT surgeons in this country. It is because they have available resources, taxpayers' money to travel abroad. If he was spending his personal money every time, will he be going abroad? Please, Femi shouldn't say that again. We have very, very technical, very, very passionate, very, very amiable physician in this country that can do whatever is done there. We know where the president is being treated. He's seeing Nigerians there because the Nigerians there have better facilities to treat. They have better welfare packages. They have better research packages because they see more of these things in an enabling environment. But you leave your country alone. You don't give doctors proper money. You don't give nurses proper welfare. You leave the country and go abroad with our taxpayers' money. I think Femi Adesina should apologize to Nigerian doctors because one doctor seeing 6,000 patients in this country is a lot of Herculean tax. And you can't say that we don't have enough expertise. We have the best brains in the world. If you look at the global statistics, even in NHS in the US, Nigerians are the highest number of Africans working there. In America, the same thing. So I think Femi goofed on that particular matter, saying that you will have that. No, it's because you don't appreciate what you have. It's only when you lose them you start appreciating them. I think what government should have done is to make sure that every facet of healthcare, from primary care to secondary care to tertiary care, is well adequately funded, and there's supervisory accountability for it. If there's no accountability, you just wake up in the morning. I remembered COVID-19 happened during Buhari. Nobody could leave the country. And everybody in this country made sure that COVID was successful. What happened after COVID went away? We just went back to our old ways and started doing medical tourism again. If we agree as a country, let's shut down the shores of this country. Let's fix our own healthcare. That's what we should be looking at now going forward. Thank you.
I absolutely agree with you totally. So, stay on this train of thought. Where exactly are the gaps? What needs to be done to, rebuild public confidence in our health sector?
First things first, I think two things are important. We need to take, by legislation, take health to the exclusive list also, like you have the military, like you have the railway roads, like you have the ammunitions, like you have like you have other ambassadorial corporation, foreign currency. Take healthcare to exclusive list so that it's adequately funded. Number two, we must have an health service commission that takes care of the welfare of doctors and healthcare workers in this country. You have Police Service Commission, you have Judiciary Service Commission. Why is there no healthcare commission in this country that takes care of the welfare of those that work efficiently and work in resource limited area in this country? You can imagine a doctor leaving his house at 1 a.m. in the morning going to do a call, and on the road is maimed, is killed by a security man, and nobody hears about it, and nobody cares about the family because nobody really cares about them. What happens to people that are coming from below? Every young doctor now wants to leave the country because it's not secured, no welfare packages for us, no enabling environment. I believe we must show ourselves as leaders. If we say we lead the country with love, we must lead this country well. If all the chairman of local government says, I want to use the primary healthcare center in my locality as a driven value for healthcare there, people in the area also will know that if the chairman is using using the PPHC, then I can use it. If the governor in a state says, I will do my surgeries, I will do my healthcare in the hospital in my state, the people in the state will believe in it. If the president of Nigeria says, okay, I will use healthcare in this country, and because of that, people will look at it. People start loving the country the more. Don't tell us to do what you don't preach. Preach what you say. If you love the country, if you love Nigeria, use Nigerians' healthcare. Let us have what we call practical way forward of impacting and shifting policies. Don't say let's give what we have for the country as young doctors, as young nurses, as young lab technicians. Let us give our life for this country. Let's be rewarded for what we are doing. You know, right now there's a 21-day ultimatum for the federal government on a very, very needless, reckless circular that was gazetted by the national SWIC, saying that we should earn nothing commendable to the work we do in this country. It's painful that this country does not appreciate what we have. We have the best brains in the world, the best technically driven doctors and nurses, passionate. When they leave this country, they are the best in their field. I think we should focus on ourselves. The government should focus on how do we treat ourselves like ourselves. Don't say that because one man is in Kafanchan, one man is somewhere in Agege because he doesn't have the right funding for medical tourism. It shouldn't be taken care of. There must be focus on our primary health care, focus on our secondary health care, and be focused on our research. That because Africans Nigerians must begin to help Africans by themselves. Right now, the government must wake up and give what is due to healthcare and give what is due to the doctors and nurses in this country and make sure that we're happy to stay in this country. Those of us that are left, let them make us happy again. Thank you. Very
well said. When you say the government should wake up, you do paint a picture that things are still the same old same. Despite the rhetoric and narrative we've been hearing from the current administration, which has health as one of its cardinal renewed hope policies, and a Professor Ali Pate as the Minister of Health and Social Welfare, are you saying nothing has changed in the health sector, Doctor?
We can say there are policies changing, but implementation is the problem. The reason why NMA has given the government 21 days ultimatum is not because that we are not hearing the policies, but implementing them. Can you imagine that the government owes doctors in this country 18 months arrears salary, owes doctors 7 months arrears salary for 18 months. 18 months. Some doctors have planned for that money for their children's welfare, to change their cars, to write their exams, to improve their quality of their life. But for 18 months, they've waited. Who does that to an employer? Even international trade law does not accept that an employer will owe his employee for over 18 months. How do you want them to be patriotic, to do their work joyfully? That's why you see now the doctors are overburdened. We are losing doctors every day. People are dying every day. So the policies are there, but how are they being implemented? How are they being monitored? How are they being carried along? Some people just write policies because maybe because it's like he works in the USA, he works in the UK. They do what we call copy and paste. We have not taken the research of our own natural habitat, natural population, to look at what is peculiar to us as a nation and use what we call indigenous ideas to solve our problem. One thing I know is that the doctors, the healthcare workers, the nurses that work in this country work tirelessly. They are passionate about helping the country, but they don't get required remuneration, required value by government. So the government have done well on face value or writing policies, but how are they implementing it? How are they accountable to the people of this country? 220 million people in this country. How is the government accountable to them? Thank you very much.
Thank you very much. Nigerians do deserve the very best of health care. Dr. Benjamin Olowojebutu, thank you very much for joining us as the first Vice President of the Nigerian Medical Association.